So I want to talk to you a little bit about optic nerve sheath meningioma. And the major thing you need to know right off the bat is that meningioma is usually a benign tumor, and sheath meningiomas are typically WHO grade 1 benign meningiomas. You have to differentiate the secondary from the primary optic nerve sheath meningioma. So the primary tumor means it's just in the sheath. A secondary tumor came from intracranial and went into the sheath. So the secondary meningiomas are going to neurosurgery and are going to have surgery. The ones that we're talking about today, however, are the primary optic nerve sheath meningiomas. And what that means is it's just in the nerve sheath itself. It's not inside the head meninges, just the sheath of the meninges. So when you have a sheath meningioma, it often makes this tram track sign, which is enhancement in the sheath, and in the coronal view, it'll look like a target where the sheath is enhancing. Now sometimes the tumor can grow and it takes on this kind of configuration where it looks like it's like a bubble around the lollipop stick of the nerve. Both of these are common sheath meningioma imaging characteristics. And because we don't want to take this out, because the sheath contains the blood supply, we're going to use the primary treatment modality, which is radiation therapy. So either we're going to observe this person, and that's typically what we do, looking for vision loss, or if the goal is to preserve the visual acuity or visual field or decrease the rate of progression, then we're going to be doing radiation therapy. And typically what we're going to be using is stereotactic radiotherapy. And because we want to conform the radiation onto this lesion, that is what we call conformal. And we're going to use a three-dimensional modality where we modulate the intensity of the radiation therapy so that we can conform the isodose curve onto the shape of the lesion in a three-dimensional conformal fashion. We're going to use fractionation to reduce the toxicity to the nerve. And so the treatment of choice for the sheath meningioma that is primary, if you are trying to spare the vision or slow the progression, is stereotactic, conformal, intensity modulated, stereotactic, fractionated radiation therapy.